All right, so let's get started the review. We are going to start right now, okay? So it's going to be short but very substantial. Are you ready?
Okay.
Everybody's ready?
Mm-hmm.
Okay. So we will talk about some drugs that are going to be important for schizophrenia, right? So one of the most important is the haloperidol, right? The haloperidol. The haloperidol is just a moment, just to be sure. Okay, one of the drugs that I want you always to review is the haloperidol. Okay, go to. Okay, so haloperidol, what is doing? Haloperidol as a side effect. So haloperidol is something that we do in order to decrease the psychotic state of schizophrenia. So basically, what we want to do, just remember the neurotransmitter dopamine. Dopamine is going down, and that is going to bring some side effects, like what, for example?
Tremors.
Tremors. There you are. So actually, we have abnormal muscular movement. Why? Because the dopamine is low, right? So that is one of the side effects of, we call that ESP, right? EPS, sorry, EPS, ESP. ESP, what is ESP? EPS. EPS is the extra pyramidal syndrome. Okay, we got that, everybody.
Yes, thank you.
Okay,
Yes.
so we have the buspirone. Buspirone. What is buspirone? So you imagine you are waiting the bus very quiet, and with all the time of the world, the bus is going to take you somewhere, right? So buspirone is indicated for what? Remember, buspirone is used for is the no benzodiazepine medication, no sedative, right? And that is basically the treatment for anxiety will be benzos, could be phenobarbital, and buspirons. And the buspiron is is being used for anti-anxiety as anti-anxiety. Just remember, it's not used for any other reason, not for depression, not for schizophrenia. Buspiron, is that clear?
Yes.
Okay. Who can we? Okay. All right. So we have here um, the SSRI. What is the SSRI?
Selective serotonin reuptake inhibitor.
Yes, yes. So, and just remember, this SSRI is can uh, they are going to be interactions some drugs with some drugs. So some of these herbs will be, for example, Saint John's wort, right? Saint John's wort can interact with SSRI, similar with anticoagulants. The anticoagulants are going to be basically warfarin, heparin. They can basically an increase of the anticoagulant effect. So what we need to do is to decrease the dose of warfarin and heparin because it's going to potentiate the anticoagulant coagulant effect. Okay, so we have the mm, We have first generation antipsychotics and the second generation antipsychotics. And one of the second generation antipsychotic is going to be the, for example, Respiridon. This Respiridon is used as antipsychotic. What they're doing basically, this Respiridon especially is going to decrease the delusions and paranoia, hallucinations, delusions. That is what is being used antipsychotic. So in cases of acute stage of psychosis. Okay, so we have the MAO inhibitors, and these MAO inhibitors are used for Parkinson and is used as antidepressant, right? So that is going to increase the the levels of serotonin. What happened here is that you need to prevent or to avoid take MAO inhibitors with meals. What meals are those? MAO inhibitors. You don't want to eat what?
Is it grapefruit?
Yeah, grapefruit is one. MAO inhibitors. Beer, cheese, sausage, right? Remember the MAO
Yes.
inhibitors, selegiline,
Yes.
L-depril. Those are going to be used to as a anti-Parkinson, and that is going to be for antidepressant. All right, so we have the lithium. The lithium is, you need to remember what is the therapeutic range for lithium? Therapeutic range for lithium. Okay, so that is something that you need to find out, please. Okay, so and remember, I was telling you that the value is very similar to some laboratory values of the kidney, especially the creatinine, right? Remember that? No, don't remember. Hello.
Sorry. No, I was trying to look it up.
Okay. So yeah, all right. So everybody look for that. Okay. So the what is the therapeutic range for lithium? Another drug that you remember that we talk about the phenothiazine and phenothiazine and no phenothiazine. The
Zero
phenothiazine
point 0.6 to 1.2
zero point 0.6 to 1.2. Yes, and that is the same value of what? Of the creatinine.
creatinine. Yeah.
Creatinine. Creatinine. Okay. Okay, so the phenothiazide, what happened is all these guys, antipsychotics, are going to have basically decrease the dopamine, right? And decrease all the neurotransmitters, like very common can be decreased the acetylcholine. So basically act as an anticholinergic. So all these phenothiazines, the taurusin, the alloperidol, the promethazine, all these guys are going to have some anticholinergic effect. So saying that, what happened? You have anticholinergic, everything what?
What?
Anticholinergic,
Dry. Sorry.
Dry.
dry. So when you go in the classroom, when somebody raises your hand, ACH is cholinergic action. P. The opposite will be anticholinergic. Okay, so one of the things that we need to be careful with antidepressants is the suicidal ideas, right? Suicidal ideas that happen in the first 2 weeks of the treatment, or when you stop all of the sudden. they're going to increase the risk for suicidal ideas. Suicidal ideas. All right, so then we have another group called the atypical antipsychotics. These atypical antipsychotics, what they're going to we have the clozapine, for example, the clozapine, and the clozapine is going to have some side effects, like what? Like increase weight, so you gain weight with clozapine, and another that is very important, increase the risk for infections. Risk for infections. Why the clozapine increase the risk for infection? Somebody can tell me why? Just a moment. Okay, so let's keep moving. All right, so what we was talking about is the why the clozapine can cause infections. Somebody, why clozapine can cause infections? We mentioned that in class. Wait, just a moment. Just a moment. What happened? I'm disconnected. Somebody's there?
Hi, Dr. G.
Hi. Hi, Dolly. Thank you for coming. Uh, oh my God, what happened? Okay. So somebody can please tell me why clozapine can produce infections. Melissa, you're looking for
Yes, I'm looking through my notes. Sorry. I was going through the slides.
control fine. We'll put control fine clozapine. Control F and clozapine. Don't tell me you
I
have.
flu-like symptoms, sore throat, but because of the blood.
Uh-huh. Keep going. I should know a way to do it.
Decrease of eosinophils. I'm not sure.
Sorry, Eliza, say it again.
Decrease of eosinophils because of
Basophils?
eosinophil. Yeah.
No. But you're close by. Well, it's because produce neutropenia, agranulocytosis. Remember? We was talking about agranulocytosis. They decrease the levels of white cells. So that's why it's going to lead into risk for infections. So, Melissa, you was reading about to care about temperature, to care about coughing, respiratory signs and symptoms, because they can lead into infections of the respiratory system. You okay with that?
Yes, thank you.
Yes.
Okay. We was talking about lithium in the previous one. What are the therapeutic range or therapeutic levels of lithium? And what is the use for lithium, basically? The most important use for lithium. Wait, what? What is the use for lithium? What is the main use for
For
lithium?
migraine.
Mood
Mm,
stabilization?
Migraine.
they can be used for migraine too, but what is the main?
Bipolar.
For bipolar,
Bipolar, bipolar, bipolar, bipolar, bipolar, bipolarity. Okay. So Melissa, you give me an Eliza, give me a good idea. You're going to go to your PowerPoint and you check it out.
Okay.
Okay. All right. So you know how to use Control F, right?
Yes.
Okay. All right. So let's keep going. So what could be the when you are monitor the patient with depression? What could be your outcome? What will be your evaluation at the end? So to monitor the patient improvement. So how do you know the patient is improving?
They're socializing well.
So, socializing very well. Socializing. They're going to socialize, right? Okay, so let's keep moving. Trazodone. Trazodone is used for what? Trazodone is used for what? Somebody can tell me. How we say tras?
Antidepressant.
Yeah, and could be the side effect?
Um,
Trazodone is with Z or no?
Yes.
All right, Z Z Z Z Z Z mean
Yeah,
maybe
sleepiness,
oh,
sleeping.
dizziness.
dizzy,
Hmm.
nausea, vomiting.
Yeah, yes, yes. You found it, Melissa?
Yes.
Okay,
sedation,
so all right, so tell me one thing. I'm a smoker. I'm not smoking, anymore. I mean, yeah, well, no, no smoking.
Recreationally.
No, no, what you talking recreationally? No, no, not even that. No, I was tempted, but
denial,
ah, I was tempted, but not anymore. Yeah, so I just learned my lesson. Okay, so I'm smoking, and what is my treatment?
patch,
Yeah, patch. Okay. Which medication actually is used for to stop smoking?
Bu- bupropion
Bupropion.
and
Yes. Bupropion. 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 That is what I was saying. I was smoking. Well, I'm not. Okay. So so when you are basically having some patients with mood disorder, when you're talking about mood disorders, is basically depression, right? So that is what is your main concern of these patients when they are depressed?
suicidal thoughts.
Suicidal thoughts. That's it. All right. So do suicidal thoughts. All right. So when you are using MAO inhibitors, what could be the contraindications? What procedures are going to be dangerous to use MAO inhibitors? Hello.
Could you repeat the question, Dr. G? Sorry.
Yes. Which procedures, medical procedure, or minor surgical procedures, minor surgery, minor interventions, uh, you need to be careful to use MAO inhibitors. Which procedures?
Could it be colonoscopy?
Colonoscopy, yes, could be, but basically variant.
Bronchoscopy?
Bronchoscopy, yes. because you're going to use barium, and this barium is contraindicated because of the kidneys. Okay, it can produce damage of the kidney. So how much time you need to wait until the MAO inhibitors is washed off from your body?
30 minutes.
No, 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 no. No, one thing you misunderstand. So I didn't say how fast it's making effect or start to be absorbed. MAO inhibitors is not going to be effect in 2 3 weeks. Okay, but the absorption is going to happen in half an hour. Yes, but uh, you cannot use MAO inhibitors, for example, doing other medications like dopamine or dopamine
3 weeks.
agonist. 2 weeks, 2 weeks, 2 weeks. So you need to watch out. Remember, I was telling you, okay, so I'm going to change medication. So you need to stop taking MAO inhibitors. Okay, when do you stop? 1 day ago. No, that is not enough. You need to have 2 weeks to wash it out from your body. Otherwise, there will be problems like hypertensive crisis. Okay.
Okay.
Yes, very good. All right, so 2 weeks. Okay, so you know what is the difference between hallucinations and delusions, positive signs, negative signs of a psychotic state, right? Psychotic state. So you know which drug we are going to use in cases of positive or negative states. So you need to very clear with what is the definition of hallucinations and delusions and the organized thoughts. The organized thoughts is all these characteristic of patient with psychosis. That is, psychosis is characteristic of what? Schizophrenia. Okay?
Yes.
Yes.
Okay, so just remember one of the most common causes of no adherence for antipsychotics is going to be basically those effects that they are involuntary muscles, right? So just remember the involuntary muscle caused by antipsychotics. Please, just remember that antipsychotics are going to decrease the, for example, the dopamine. So that's why it's going to lead into EPS, extrapyramidal syndrome. It's the same to say Parkinsonism is the same, and it's the same to say pseudo Parkinsonism. Okay?
Yes.
Okay. Okay, so we have when you have these torticollis is the way, right? Torticollis or oculogyri crisis or contraction of the tongue. So if you contract your tongue or you look like a circles your eyes or your neck is totally twisted with pain, that means that it could be what? What is those side effects of what?
EPS.
EPS? Yeah, we could be, but this happened basically on the first day, on the second day of treatment, and that is dystonia. Remember, we was talking about
Oh, that's
dystonia,
right.
bradykinesia, then we have tardis dyskinesia. Remember the 3 days, the 3 hours, the three
Yes.
3 weeks, 3 months, and 3 years, right? Okay, so review that, please, please. All right, so just remember the clozapine is very important to remember. Clozapine, what is going to lead is into agranulocytosis, that is the same to say neutropenia, risk for infections. Just please remember all the terms like dyskinesia, bradykinesia, tardis dyskinesia, akathisia. So those terms are coming. So be careful with that. You must know, remember those names. All right. So how we check the patient who is taking clozapine? The clozapine basically what is going to do is to increase weight with and you can measure and you can quantify doing the waist measurement. So you check the waist, that is telling you how much the patient, in addition of the weight, of course, how much the patient is gaining weight. Okay.
Okay.
Mhm. Okay, so everybody, please, everybody need to remember what is the serotoninergic syndrome. Serotoninergic syndrome, please. Okay, that is a must. So all the signs and symptoms of serotoninergic syndrome, and you need to remember all the side effects of neuroleptic malignant syndrome. Okay. So the neuroleptic malignant syndrome is a side effect of the antipsychotics, and the serotonin syndrome is side effect of what? Antidepressants. Okay, all right. So we okay with that?
Yes.
See, that's all for today. So it's 11:17. I'm going to stop the recording. So I record this time.